Hi, my name's Noelle and I'm a nurse in the Navy, and I've come to talk to you today about a couple of things you've learned in class. Already? The first thing we're going to go over is ligaments. Then we're going to talk a little bit about bruises and pupils and the brow bone. I'm going to start first with the ligaments. Ligaments are, in your body, ligaments are stretchy bands that connect bone to bone. You have about 200 plus bones in your body, and these ligaments connect most of these bones, usually at a place called a joint. It gives flexibility to the arm, allowing the two bones to move together. And many times you have injuries to these ligaments. And what the ligament does in an injury is it either stretches too far or completely breaks. And this is normally called what we know as a sprain. And the most common place this happens is like the ankle. And all sprains should be looked at by a doctor. And most of them the body can heal themselves, but some do require some surgical procedures to fix. There are some things you can do at home or while you're going to see the doctor to help the healing process. We remember the four things you do as RICE, because each of these letters stand for the four things you're going to do. You're going to rest that injured body part and not use it if you can. You're going to put ice on it. Then you're going to use a compression wrap, like an ACE wrap or a bandage, and then you're going to try to elevate that as much as you can. And that's what you can do to help this sprain, help your body heal this sprain. The next thing we talk about is bruises. Bruises what a bruise is a discoloration that forms because there's broken blood vessels underneath the skin that have bled underneath the skin that form this bruise. And the color is based on usually how old the bruise is. What happens is when this blood vessel breaks under the skin, the body starts reabsorbing this blood. And as the body reabsorbs it, the colors change. So a new bruise would be a very bluish and purple. And as the body reabsorbs, the coloring becomes lighter and lighter. That's why you see the light yellows and the light greens as the bruise heals. And the way you get bruises usually is because you have done something to break these blood vessels, like usually a fall or hitting something, falling into something. Sometimes you can even get these if you get a bad mosquito bite, bug bite, you itch really hard and you cause a lot of trauma to the skin and cause bleeding underneath. So that's really all about the most important things to remember about bruises. So, and then again, the body will heal itself too. Next things are pupils. Pupils are the tiny black dots in the middle of your eye. The colored part of your eye is called the iris. The pupil is what's in the center of that. And the main job of the pupil is to regulate how much light comes in and out of your eyes. So, if you go into a really dark room and you need more light to see, your pupils open up and dilate, allowing more light to come in. If you're out in the bright sunlight, you just walked outside, the pupil will constrict and become like pinpoint to decrease the amount of light, because you're outside and you have all this light already. You don't need any more light to see, or you'll become very blinded. And that is mainly the job of the pupil, is they become big and small as needed when you move into different areas with the light change. So, and the last is the brow bone. Brow bone, right here where the eyebrows grow. One, it's mainly there because if it wasn't, your face would look really funny. Two, it protects the eye quite a bit. So what it happens is this brow bone stands out further than the eye along with the cheekbone. So if you are hitting something, or if something's hitting you, it will more likely hit the brow and the cheekbone before it actually hits the eye, because the eye is deeply set into this little cavity area here. And that is mainly the job of the brow bone, is to protect that eye as much as possible. And I believe that's about it.